All right, good afternoon, everyone. We're going to get started with the afternoon session, which will take us through to closing. We're going to start with the Andrew C. Novick Award, and this year's winner is Alex Kudakov, and Rob Buzo is going to do his dedication in a second. But since I'm up here, I was worried Rob wasn't going to show up, and so I was thinking about what I could say about Alex and being in Nashville and this great music scene. And I will say personally to you, Alex, we know your greatest hits, but Alex is one of those people that, as if you really get into the depth and the breadth of his work, it's incredibly high quality. It'd be one of those really great albums that what gets played on the radio, but the deeper you get into the album, you really love everything else you listen to. And you're a great thinker in our field. You've been an inspiration for many of us. So I'll say that and ask Dr. Rob Buzo to come up and take over. Rob and I have the same barber in Philadelphia, so it's great. These awards right there.
Oh, great. Thank you. Thank you. If you could bring up my slides, I appreciate it. I want to thank Brad, and I want to thank Phil, and I want to thank the organizing committee for giving me this chance to do two things. One, honor my mentor. Andy Novick, for those that did know him, was a true pioneer in the field. He died too young. He taught me so much, and I can't think of anybody better to get this award than Dr. Kudakov. There we go. So for those that didn't know, Andy was a true pioneer in the surgical treatment of kidney cancer. He didn't just teach me that, though. He didn't teach me about the value of renal preservation or how to excise a kidney tumor. He taught me that there are two parts of being a good doctor. The first is good medical decision-making, and the second is to learn the processes of care. And that's something that nobody had taught me before, and it helped me evolve as a leader. He was technically gifted as an innovative surgeon. So much of what he did, people don't do anymore. Hepatorenal bypasses, thoracorenal bypasses, auto transplants. He was an educator. He loved his residents. He loved his fellows, and he supported you. Sometimes he challenged you to the point where you didn't think you could be pushed any further, but often he just let you be who you best were. And he was the president of the ABU, the chair of the exam committee, the chair of the RSC. He did so much for our field. One of my first talks was at this very meeting in 1997. He trusted me with giving the data that he put together, and Bob Flanagan came up to me and gave me a compliment, and it meant the world to me. That's what mentorship does. He was a researcher at a time where it wasn't very easy to do 500 papers. He did 500 papers. And he was a builder. When he became chief at Cleveland Clinic, he had 7 urologists. And when at the time of his death in 2008, he had 74 urologists. And I can think of nobody better than to mimic him than Dr. Kudakov. He's technically gifted. He's innovative as a surgeon. He's a thought leader. He's an educator. I don't think there's a bigger advocate for our fellows. He's a researcher, and he too is a builder. And more than that, he's an avid reader. You talk to him about anything, as Phil said. He's an expansive thinker. He's an entrepreneur, and he is a social media force, as well as being a devoted father, husband, and son. So let me give you a little bit of his background. He was born in 1977 in Leningrad, the former USSR. He immigrated to Atlanta via Italy. I like that. In 1988, he attended Emory as a full Woodruff scholar. The Woodruff family, as you know, ran Coca-Cola for about 60 years, between 1995 and 98. Then he attended the University College at Oxford, and finally to Harvard, where he got his MD in the Health Services and Technology program. Here's a picture of his father and his mother. They met on an airplane between Kiev and Leningrad. I love the hair. It's a theme that followed the generations with Dr. Kudakov. As was mentioned, especially jealous. Here's Dr. Kudakov and his family as they emigrated in Italy. Soon enough, when Dr. Kudakov came to America, he started to watch American TV and realized this dress just wasn't going to cut it. So he really started to look like Arthur Fonzarelli after a couple of years. But there he is as a young man, hair intact. He then went to Penn Urology, where he trained under Alan Wien. His best friend and co-resident, or at least in medical school, was Todd Morgan. If Todd was here, they'd probably be rooming in the same room tonight. That's how close they are. They started Urology Match together to run the field, and he became our SUO fellow in 2008. We were very, very fortunate to land him. When I first got to Fox Chase, I was the first employed urologist. Dr. Greenberg was in private practice and joined us soon thereafter, and we started hiring. And when we hired Dr. Kudikoff, it really accelerated very quickly from there, and it just kept going with great people and great fellows that populated NYU, Mount Sinai, Cooper, MD Anderson, Case Western, et cetera, et cetera. And he built all this. He built this, through a sort of force of nature, both at Temple and at Fox Chase, a massive team of people who really stand behind him and stand strong behind him because they believe that his leadership is something special, and it is. Jess, his wife, is a physician. He says this is why he entered urology. I said yes. She said, Alex, there are some shortcomings that you need to overcome. You should be a urologist. And so they had a lovely family. They've got Bennett and Jonah, and then Lila joined the team. And Alex soon learned that time passes very, very quickly. Here they are just recently on a trip. And he still loves his parents who come in. They're so proud of him when they come into the office. And there he is with the ubiquitous phone, always taking selfies and other people's pictures. But Alex really is more than that. He's a big Swiftie fan. I don't know if anybody knows that. But here he is with his daughter Layla enjoying a Taylor Swift concert. Don't let him fool you. That T-shirt right there, he bought that T-shirt, and that's got Taylor Swift on it. And so, you might walk into his OR and see some of his favorite songs, including this one, Bad Blood, which he doesn't like to say. But you might hear things like a Band-Aid won't fix that. But he is a really big Taylor Swift fan. So he's a prolific researcher and author. Here he is writing with his children on lap, 317 papers in cancer, 189 papers in kidney cancer, almost 40 papers in bladder cancer, and then, of course, adrenal cancer, something else that he finds near and dear. Dr. Kudikoff teaches us techniques. He teaches us, he has collaborative reviews. He leads in Europe. He leads in the United States. He leads in adrenal cell carcinoma. And he's written the adrenal chapter in Walsh's textbook for the last 4 editions. And finally, I'm just going to end with this, that if you sort of Google Alex Kudikoff, you're going to get lots and lots of pictures of Alex Kudikoff because he's such a social media presence. But you're also going to see a couple pictures of this guy right here. And you ask yourself, like, who is that guy? Right? But that's that guy right there. That guy is Alex Kudikoff. There is a Russian rocker named Alex Kudikoff who was born in Russia. Sound familiar? And he was in some band called Mashina Vremya. He has also written the soundtrack of Dusha, which is, I guess, Russian for soul. And so I think that there's something going on here. I haven't really been able to put this together, but this might be an alter ego for Dr. Kudikoff. I mean, come on. You got to admit there's some similarities. And, Masha Vremya means time machine. So if you ask me, this guy right here might very well be this guy right here. That is not a stretch if you ask me. There is no way that's a stretch. You remember, we're in Nashville. Garth Brooks did have an alter ego named Chris Gaines, so it is quite possible that these two people are the same. And I'm just going to sort of say, I asked Dali, what would he look like if he was actually an alter ego rocker and a surgeon at the same time who enjoys chess, and this is what Dali gave me. So I'll finish with this. I wanted to figure out if these two people were the same people. So I went through the checklist. Well, Alex Kudikoff 1 is a baritone, and if you've talked to Alex Kudikoff 2, he too is a baritone. The official website for Alex Kudikoff 1 is kudikoff.com. The one for Alex Kudikoff type 2 is drkudikoff.com. That's not a big stretch. These two people might be the same. The signatures look a little bit the same. If you look at that one, at the last one, there's this straight line. I think that's a deep fake, if you ask me. That's a man trying to hide something. In terms of social media followers, Alex Kudikoff 1 has 1,100. Alex Kudikoff 2 has 11,000. And then we get a little bit tricky here. This is where I sort of had to ask the question, are these two people really the same? One is a guitar and a bass hobbyist, and one is a chess and a Tesla champion. And then, of course, the awards, the Order of Honor, Order of Friendship, and, of course, Dr. Kudikoff, the Novick Award. So in the end, this Alex Kudikoff rocks, and so does this one. These are two Alex Kudikoffs that rock. So on behalf of all your peers, friends, colleagues, nurses, technicians, doctors at Fox Chase and across the country, thank you for all you do. Thank you for leading us. And I'll tell you one last thing. I had a patient once that had a solitary kidney, and it didn't look like they were going to have any options but dialysis, but I was able to save the kidney. And they gave me a gift about 3 months later when they came to see me. They pulled up their shirt and they said, "Here's what I got. I got some ink." And they said that they were grateful. And I think that you make people grateful for the job you do, and you certainly make me grateful for being able to spend my career with you. So if I congratulate the Relax Kludikoff, here it comes.
Well, there's been a leak. My secretary's in trouble. Some repeat on my slides, but it's all right. This is an incredible honor. It's that much more meaningful because when I was a fellow, when I was standing across the OR table with Rob, to whom I owe so much, he would tell me stories about Novick and sort of his approach to clinical medicine, his approach to life, and I know how big of a mentor Dr. Novick was to Rob, so this is an incredible honor. So some of this is going to repeat, we're going to go fast. With everything that's going on in the world, my parents, my dad with all that hair, basically kicked somebody out of their seat to sit next to my mother on a flight from Kiev to Leningrad. And she tells me she didn't call him for 4 months, and then, 2 months after she called him, they got married. So this was my tweet on February 24th, 2022. I was born in Russia, but I spent all my summers in Ukraine with my grandparents, so what's going on over there is just unbelievable. This is sort of, we've went over this, but here I was, into urology very early on, as you can see. And this is my family, and with everything that's happening in the world, I call my parents regularly and just thank them for bringing me to America at a young age. And that I had a passion for chemistry when I was in college, and that was me at Oxford doing a year of inorganic chemistry, But this is, talking about chemistry, this has been my catalyst in life. This is my wife, Jess. She, as Rob had it, she's the one that sort of gave me the idea of entering urology. I had no idea what I was going to go into, and she said, "Well, why don't you do urology? All the guys are cute, and they seem like they have fun." And so I said, "Okay." I was, her, as I'll say in a slide, sort of, she grew up in South Jersey in the Philadelphia area, and she said, "Well, if you go into urology, you have to match at Penn." And I said, "It's a really hard program." She says, "That's all. I want to go to CHOP, and you have to go to Penn." So I met Alan Wien, and he was a huge mentor of mine through the years, and that was a great place, and we got incredible training. But I did 0 robotic partial nephrectomies. I did an open residency. I think this is why our fellowship these days is so attractive to trainees, is because everybody on the team is a great open surgeon, and we can tackle these cases that are just difficult to tackle minimally invasively, although we do so much minimally invasive surgery these days. But there, you got really 10 of those days, you got a lot of independence, and I think that's really critical for training a surgeon. There's just the little decisions you make in the operating room. When the attending is in the room, they just don't happen. So that was really tremendous training. And I want to give a shout out to Doug Canning. Those of you in the room who knew him, he was a huge influence on me. As you can see, this is from my chief resident slide, where he was somebody I really looked up to. This was a man who was a mentor to many, and he was chief of pediatric urology at CHOP, and he very prematurely passed just over a year ago. So huge shout out to Doug, who I think influenced me in a number of ways, including how to just Doug would care for these very challenging patients, and he would always say, you know, you just got to lean into it. You know, the harder the patient, the bigger the complication, the bigger the challenge. You got to lean in. And I kind of remember his voice every time, you know, sort of there's a clinical challenge. You got to give that patient more attention, not less. So, you know, we had 2 kids during residency, and, you know, here's this my mother-in-law over there, and there was a circle that my wife drew on a map. She said, you can do whatever you want, but you just got to be, you know, in this little circle. And so I was going to do pediatric urology, and got a little bit cold feet, and I met this guy at a meeting. I was like, he seems like he has, you know, sort of, he's got it figured out. And honestly, I wasn't going to do oncology. There was just no other fellowships in Philly. And so these guys were starting a new SEO fellowship. I was like, okay, I'll do a fellowship, and I'll do oncology. And so I joined Fox Chase team. And, you know, Rob really does have everything figured out. It's, you know, it's one of those people that, you know, since the day at least I met him, and I know it's so true for so many fellows and residents that come through our program, is you just want to be like him. I mean, he's, you know, clinically incredible. He's an incredible clinical surgeon. He's academically just an absolute powerhouse. You know, he's done it all. Clinical trialists, you know, clinical manuscripts, research manuscripts, incredible mentor. Administrative, I don't know if you guys didn't know, he now runs Fox Chase. He's the CEO. Note to self, never sign up for that job. He's past chair of surgery, has been, you know, and what also meant to me then and still means to me now, he's an incredible father, an incredible family man. And, you know, sort of he strikes that balance where, you know, all those other quadrants are important, but family's always first, and he sets an example. And I think that's why our group is so strong, is that we, you know, we always make sure that kind of the personal aspect, you know, doesn't get forgotten, and people have the you know, the sort of the energy and the passion to do all the other things that they do, because the personal piece is in place. I joined this fellowship, and there were other mentors. Steve Borgen was, you know, who's now leads Mayo Clinic Urology, was a huge mentor. I started a fellowship, and Steve was his first day as an attending. So training with a junior attending of that caliber, you know, it was fantastic, and I learned a ton from Steve, Richard Greenberg, Dave Chen, Leva Turbo, who are now my partners. It was really just an incredible team that we've been able to grow. And so I don't know what version of DALI you use, Rob, but this is the version of DALI that I put the last few slides into, and this is what it puts out. It's pretty amazing if you sort of do, but I just wanted to point out that's why I put it in here. It's pretty good. So, you know, I know we're sort of against time here, but, you know, I got the academic book from Rob. I honestly, I remember talking to Steve, and Steve would say, what are you gonna do? And I said, private practice. I don't want to do this academic stuff, like Me Too paper with worse data. Who cares? And you know, with Rob and Steve and that group, we really started writing some papers. I said, listen, this is really interesting, and I think we're moving the needle in understanding how, you know, we take care of kidney cancer and other cancers. And this was some of the first papers. This was our JCO, competing risks of death model. We built the nomograms, had several follow-up papers. You know, we've had this cancer nomograms project out on the web, which, you know, people still use, which is, you know, it's a good jumping off point for a decision. We operationalized ours and everybody else's nomograms. And then, you know, we basically came up with this idea. I mean, and this was, you know, in a time where the communication and the literature was really not standardized. And I wrote this paper in Cherry Hill, New Jersey Library over the weekend. And Rob and I had a few iterations of what to call it. And I have to give Jess, my wife, I think we had diameter, and then we had ENAL, and I was trying to come up with a sort of a good acronym. And she said, why don't you change diameter to radius, and why don't you call it renal? And so every time Journal of Urology comes in, she's like, how's my paper doing? It's good. So 2,300 citations, you know, sort of this thing really popped. And I'm just going to just show a few slides from the, going back to 2009, this is where the literature was. Most series lack. This are slides from our plenary at AUA for the podium at AUA for this paper. Most series lack any anatomic descriptors of tumor anatomy or offer descriptions that are qualitative or incomplete. So, right, people would just describe them, and they would publish, I did 100 partial nephrectomies, and you wouldn't know what they were really operating on. And they would report their complication rates. And so this paper sort of helped this field have an objective and standardized way of communicating anatomic complexity of tumors. So, it made a big difference in sort of how we talk about kidney cancer. So going back to 2023, we've done a lot of work. I'm not going to belabor it here, but one of my interests has been sort of this treatment disconnect. Why isn't mortality going down when we operate more on kidney cancer? We had a paper a few years ago in medical care showing that we actually may be making a bigger difference than we think. We've written a lot about sort of breaking up the decisions that we make in localized kidney cancer. In an active surveillance. But if you really think about the decision-making process in localized kidney cancer, we saw it during the Chris Wood panel earlier, that there are a lot of opinions. And this is because there is so many factors that get factored into making a decision about the same renal mass, but in a different patient. There's patient factors, there's kidney factors. How is the contralateral kidney? What does the size look like? And then there's the structural factors for how good of a surgeon are you? How well can your colleagues support this patient if you do tackle a more complex surgery like a partial nephrectomy and somebody who's anticoagulated and all those things. So there's a lot that goes in, and we've tried to sort of contribute to the literature and to better understand this, break it down and objectify this decision making and sort of operationalize it. Talk about ischemia. We're just talking about TikTok. This was our paper on, for urologists probably should stop the TikTok dance since looks like time of ischemia probably matters very little, and it's really just save the parenchyma. And then this is a little bit of a spicy topic of this partial versus radical that I'm interested in. It's we all struggle with this, and we've written a lot about it, and how to make that decision and how to standardize and how to when do we actually help with a partial and when do we harm, and a lot of unanswered questions in this space still. Renal biopsy. We wrote this with Brad, with Dr. Leibovich. More than never, less than always. And recently, we've sort of, these are more recent papers. This is our cystamebia experience from Fox Chase. And this is sort of a passion project. These are cystic renal masses. And there's this narrative around cystic renal masses that I think is not quite sort of accurate. And there's a lot of work to be done here. Here, I'll play this little video since, surgery talk. Can you click on that video and play it? So there's, the masses sort of, these Bosniak masses this is what it looks like when you take it out. This is a robotic partial for a big mass. And when you sort of open this mass, you can see that some of them really have these high-grade components. And we're not great about figuring out which masses harbor these higher risk pathologies. This was cover of Urology a few months ago. This paper made it with our new partner, new hire, Randall Lee. And what we found in our series of operating on Bosniak 3 and 4 masses is that 23% were high grade. And the other important point, and we really sort of want to make sure that the messaging is accurate here so all these masses don't get overtreated, is that everybody we kept on active surveillance or if we had delayed intervention, nobody metastasized. It was incredibly safe. But there's really a subset of these masses that are not cystic and they're necrotic. And when we scrape the literature based only on pathologic findings, we don't actually capture all these masses. So 23% of radiographically cystic lesions revealed high-grade disease, but 25% of graphically cystic lesions upon resection never had pathology mentioned that they were cystic. And that's a problem because a lot of the literature out there uses the pathologic scrape as the basis of drawing conclusions about cystic masses. There's a big disconnect right now between clinical, radiographic, and pathologic descriptions of cystic masses, and I think as a field, sort of as in localized kidney cancer, we got to reconcile these three fields that are in their own silos describing cystic masses, but they're completely different masses. And as Rob said, the journey continues. This is, you know, I couldn't be at a better place. It's so, honestly, it's exciting to wake up and go to work every day. We have an incredible team that grows really almost every few months. And, you know, sort of in the model of Andy Novick, who had the Urologic Institute in Cleveland, there's now a Urologic Institute in Philadelphia, the Fox Chase Temple Urologic Institute, that, you know, other than Phil, provides the best urologic care in Philadelphia. Well, thank you very much. It's such a privilege and honor, and thank you for this award.
One of the greatest compliments anybody ever gave me is to say, Andy would be proud. And of course, Andy would be proud.